Hello, my name is Hamish Mckee. Today I'll be talking about the effects of transcranial direct current stimulation on schizophrenia. So, the content for today is physiological mechanisms of schizophrenia, physiological effects of transcranial direct current stimulation, or TDCS, a literature review on how TDCS influences schizophrenia, and gaps in existing literature, as well as suggestions for further research. Physiological mechanisms of schizophrenia. So, the underlying causes of schizophrenia can be a severe reaction to anxiety, having its origin in childhood and experienced again and reinforced in a later period of life, cannabis use and other use of illicit substances, genetic. So, research suggests that genetic transmission of schizophrenia is not due solely to a single major gene, but several different genes. Traumatic life events. So, children who have experienced severe trauma are 3 times as likely to develop schizophrenia in later life. Neurobiological areas affected by schizophrenia. So, the prefrontal cortex. So, schizophrenia causes dysfunction of the prefrontal cortex by several mechanisms, such as perfusion defect, defective metabolism, and defective synaptic pruning. The prefrontal cortex is responsible for complex tasks, known as executive functions, including decision making, strategizing, and adjusting behaviors according to social cues or past experiences. The medial temporal and superior temporal. So, people with schizophrenia have been found to have reduced grey matter volumes of the medial temporal and superior temporal areas, which can cause dysfunction as these regions are responsible for episodic memory, processing of auditory information, and short-term memory. The basal ganglia. This region is known for producing dopamine and regulates coordinated movement. Research demonstrates people with schizophrenia have increased activity in the basal ganglia and decreased connectivity between this region and the prefrontal cortex. Individuals with schizophrenia have an imbalance of brain chemicals such as dopamine, glutamate, and serotonin. These neurotransmitters allow nerve cells in the brain to send messages to each other. Disturbances with these chemicals have been increasingly documented in a range of neuropsychiatric disorders, including schizophrenia. Physiological effects of TDCS. So, first off, 2 electrodes, the anode and the cathode, are placed on the scalp. There are several different methods which are used to measure the placement of the electrodes. The most common method is the EEG system. This is usually done by measuring from the pre-auricular to the right pre-auricular. Current then flows between the anode and the cathode, passing through the brain to complete a circuit. This current going through the brain changes the neural firing by strengthening synaptic transmission between neurons by augmenting synaptic plasticity. TDCS has been used for a range of different mental illnesses. So this includes depression, schizophrenia, epilepsy, addiction, and chronic pain. Review of literature on how TDCS is proposed to influence the psychological mechanisms of schizophrenia. The first study looked at the efficacy of TDCS in reducing the severity of auditory verbal hallucinations as well as negative symptoms. The method consisted of 30 patients with schizophrenia who experienced auditory verbal hallucinations despite being on antipsychotic medication. They were randomly allocated into 2 groups. Group 1 to receive 20 minutes of active 2 mA TDCS, and Group 2 received the sham. So this was an extremely low current which acted as a placebo. Both groups received stimulation twice a day on 5 consecutive weekdays. The anode was placed over the left dorsolateral prefrontal cortex and the cathode over the left temporoparietal cortex. The outcome showed a significant reduction in auditory verbal hallucinations in the TDCS group compared to the sham stimulation group. The effect of TDCS on auditory verbal hallucinations seems to be maintained for at least 3 months. This long-lasting effect could not be explained by changes in medication, as all patients continued the same medication throughout the entire study. This study investigated the effects of TDCS on working memory and negative symptoms in patients with schizophrenia. So the method included 24 participants who were randomized to either a sham or active TDCS treatment group using a current of 2 milliamps for 20 minutes. The stimulation was performed over 2 weeks, so Monday to Friday, with a total of 10 sessions. The anode was positioned over the left dorsolateral prefrontal cortex and the cathode in the contralateral area. Participants were assessed at baseline, after treatment, and in a 3-month follow-up. The outcome showed positive therapeutic effects of TDCS for treatment of persistent symptoms in schizophrenia. Long-term effects, which is 3 months, also showed significant improvements. There was also normalization of the frontal cortex, and there was no significant evidence that TDCS improved working memory among schizophrenia patients. The aim of this study was to investigate the effect of TDCS on the resting state functional connectivity, or the RSFC, of the left temporal parietal junction, or the TPJ, and by doing this, reduce audio-visual hallucinations. The method involved 23 participants with schizophrenia. All participants showed daily AVH despite antipsychotic medication at an adequate stable dosage for at least 3 months. Participants were randomly allocated to receive active TDCS or sham. Active TDCS group received constant current of 2 milliamps for 20 minutes, and the sham group received a 2 milliamp current, which was delivered only during the first 30 seconds of the 20-minute stimulation period, mimicking the active TDCS. 10 sessions conducted twice daily on 5 consecutive days from Monday to Friday. The outcomes showed that the active TDCS significantly reduced the left TPJ RSFC. A significant positive correlation was found between the reduction of AVH and the decrease in RSFC of the TPJ and the left anterior insula. Significant reduction of AVH severity, as well as the negative symptoms after active TDCS compared to the sham. Results suggested that the effect of TDCS was not restricted to the functional connectivity between the brain areas located under the electrode sites, but also a large distribution of the neural network. Future research. There are still gaps in research that need to be addressed in the future. These gaps include additional post-treatment evaluations such as quality of life and social autonomy of patients, control over variables such as coffee intake, quality of sleep, amount of exercise, and nicotine, as this influences the outcomes due to changing the state of the brain during, before, and after the TDC session. Sample characteristics such as duration of schizophrenia, level of functioning, and baseline clinical and cognitive profiles should be assessed, and also larger sample sizes.